Hi, I'm Dr. Eric Aubert. Welcome to Forest Park Dental. One of the things I pride myself on here at Forest Park Dental is my staff. I have a very meticulous staff that has been with me for many, many years of experience. We have staff members that have been here over 20 years, over 15 years. I think the combination of years is somewhere over 70 years of experience that my staff being with me. They've been highly trained and they're highly qualified to complement me here with doing the best technological advancements that we possibly can achieve at Forest Park Dental. It's to the point where some of the patients, a lot of times, they don't even want to see me. They want to come and see my staff for their gentle and caring touch that they provide. The technology that we have is the most advanced technology in the country. 6% of dentists in the nation have CEREC technology, and CEREC is where you can actually come in and we actually scan with the blue camera, fiber optic camera, and design the crown while you're waiting, and we actually mill it in a robotic milling machine, which is just amazing. We also have CT cone beam 3D technology, which allows me to actually radiographically see everything in 3D. 96% of dentists, 97% of dentists, especially general practitioners, don't have that type of equipment. It allows me to be able to place an implant on my computer before I ever go to the patient and place the implant, seeing exactly where the implant goes, knowing exactly where to place it without involving any nerve involvement, and then thus not complicating the case and having close to 100% success rate. INVISALIGN is also another service that we offer. Not only do we just offer INVISALIGN, I am actually in the top 5% in the nation. I'm what you call a preferred premier provider, and I believe I'm the only general practitioner in this area that offers INVISALIGN, being a premier provider, which means that I've done hundreds and hundreds of cases, several hundred cases, and the experience that I've had with INVISALIGN is incredible. It's touching to see a patient come in not smiling, no self-esteem, lack of confidence, and what INVISALIGN has helped to do for them. And with my experience and expertise, it's amazing things that we've done and the lives that we've changed. I can just think of several cases where women have gotten married after I've done INVISALIGN, or it's helped men to be more assertive in the business world. So not only are we just a provider, we're a premier provider, and I think my expertise speaks for itself. All of our radiographic equipment here is all digitized, so it's up to 80% less radiation than your typical dental x-rays. I was probably on the forefront of practitioners in St. Louis being digitized. I've been digitized since the early 90s, and it's wonderful because I treat a lot of the physicians across the street, a lot of radiologists, and they love it, with it being the lack of the radiation that your typical dental offices have. I possess a cone beam, and a top-of-the-line cone beam that I think is the Galileo. And the Galileo allows me, it's a CAT scan, and it allows me to actually see 3D everything in the mandible and the maxilla area. And it's very helpful in diagnosing certain things that dentists may not be able to see. It's also very helpful when I'm putting implants in. When I put implants in, instead of just guessing or going by a Panorex or an intraoral, I can place that implant utilizing the cone beam computerized technology, and then see exactly where it goes, and by bypassing any type of nerve involvement or anything like that, sinus perforations, it's a wonderful tool to have, And I believe as far as general practitioners, it's probably 2 to 3% of general practitioners have a cone beam in the nation, and I'm one of the few. Many years ago, it would take 4 or 5 appointments to do a root canal and a crown. Now a patient can come in within an hour or 2, have the root canal done, which we use the computer to do a root canal. It's just amazing, and it's all digitized, it's all computerized, it's all just at a touch, and it's high-tech, state-of-the-art dental care that's delivered here at Forest Park Dental. It's just a pleasure coming to my office every day because it's all digitized, it's all computerized, it's all state-of-the-art. We just renovated and did everything, renovated the whole office last year. And when I renovated the office, I put in totally all state-of-the-art cabinetry, sterilization, the sterilization center. So behind the scenes, not only what the patient sees, but what the patient doesn't see has all been computerized and updated to state-of-the-art equipment as well. KC Multimedia provides the patient with explicit details post-operatively of what they're to expect after each and every procedure, whether it's fillings, whether it's root canal therapy, whether it's crown and bridge, whether it's extractions, whatever it may be. Also pre-operatively, it explains to them exactly what I'll be doing as far as the procedures, and it gives them a breakdown and a total understanding of everything. And it's able to print out everything that was said that they viewed on the computer. So it really helps a good communication with the patient understanding everything. We're in a 130-year-old historic castle building that is beautiful from the outside. It looks like a castle, and on the inside it's high-tech and modern technology. We're conveniently located in the heart of the Central West End, right adjacent across the street from Jewish Hospital or Centers for Advanced Medicine, BJC, on Forest Park. So it's in the heart of Forest Park, Central West End, and it's accessible from anywhere. I pride myself in providing the best quality of care. But not only that, I've been a member of the Missouri Dental Board. The Missouri Dental Board polices all of the dentists within the state, and Governor Holden appointed me to the board 8 years ago, and then Governor Blunt reappointed me to the board 3 years ago. I'm also a board examiner for dentists that are coming out of school. I also pride myself in having well beyond the number of continuing education hours. It's a law for dentists to have 50 hours every 2 years. I'll give you an example. Within the last year, I had 300 hours in going to New York University in an implant continuum, University of Miami, doing a fellowship or in implants as well, continuing education in INVISALIGN, as well as all other aspects of restorative dentistry, which aids into providing the best superior quality care. I hope you, your friends, family, and loved ones will come to experience modern dentistry with the soft touch, and where your dreams will come true here at Forest Park Dental. I'm Dr. Eric Aubert. See you soon.